Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Colorado, and I offer online therapy via Skype worldwide. All you need is a good internet connection and Skype, and we can schedule Skype therapy sessions. So if you're interested in talking to an online therapist for effective help with anxiety, I invite you to go to my website and learn more about the mindfulness-based psychotherapy that I offer online and that I specialize in. So mindfulness therapy is a very effective way of working with anxiety. It's really quite different than conventional counseling, and it's also a better alternative, in my opinion, to medications. You want to address the underlying cause of your anxiety. You want to change the habitual reactive process that creates your anxiety. Medications can't do that. They're not able to change the underlying psychological habit that causes your anxiety. And often just talking about anxiety is not sufficient to change the mechanism that creates your anxiety. That is the focus of mindfulness therapy, and I've worked with many people over the years now, and they all really like the mindfulness approach. It gives greater insights than are typical with standard talk therapy, and it gives you the tools to work with your anxiety and produce effective change. Typically, people see me once a week, often only for 3 or 4 sessions, sometimes longer if it's felt necessary. But that's what you should be looking at. Effective change does not take years of therapy. That simply indicates a very inefficient style of therapy or therapist. Real change can happen very quickly, and you can see real change in your anxiety once you start really addressing the underlying habitual cause of your anxiety. In mindfulness therapy, we do this by developing a very conscious and mindful relationship with our emotions. We look directly at our emotions and we see how they work. The first thing we focus on is the constellation of habitual reactive thoughts that have the effect of reinforcing the underlying anxiety. So the anxiety is kept alive by reactive habitual thoughts. So we need to work at that level. We need to develop more mindfulness to see these reactive thoughts in progress so that we can stop them and that we can begin to disengage that fuel source from the anxiety. So being able to sit with the emotion without getting lost in reactive thinking is the first step in mindfulness therapy and the first major step in healing anxiety. When you have now established a non-reactive relationship with your anxiety, then you can begin to help it heal. And that is the second major theme in mindfulness therapy. It's all about healing. It's not about learning to cope with anxiety or tolerate anxiety. We're not really interested in trying to tolerate anxiety. We're interested in healing the anxiety, in resolving it so that you no longer suffer from the anxiety. So we do this in mindfulness therapy by developing a compassionate relationship with our anxiety and with other emotions that are associated with the anxiety. Compassion is an extremely powerful force, and it's very much a part of mindfulness. Mindfulness can be defined as compassionate awareness in the present moment. So that means bringing compassionate awareness to your emotions in the present moment. So this describes a process of meditation. Basically, we're learning to meditate on our emotions rather than just ignoring them or trying to cope with them in some way. We are actively trying to promote their healing by directly meditating on those emotions. So developing a compassionate response to our emotions is an essential part of healing. The third aspect of mindfulness is even more direct than that, and that is to actually look at the structure of the emotion. What is it that causes that emotion to arise in the mind? And the primary factor that constructs our emotions is imagery. The imagery of the emotion is what really holds it together and causes it to come into being. That imagery gets triggered by various factors, internal factors or external factors, but it's the imagery that actually causes the emotion. So that's the in-between step, if you like, of the habit that creates emotions. So we look at this imagery when we are studying it in meditation. We're looking to see how that imagery works, and then we investigate how to change that imagery, how to help the emotion heal. So when emotions heal, they do so by changing their imagery, either with our involvement or not. The imagery has to change for the emotion to heal. So we help it change directly during our mindfulness meditation sessions. I will teach you how to do this, how to apply mindfulness to work with your emotions and with your anxiety to facilitate healing. And because it's such a direct approach, mindfulness is often called the direct path to liberation and happiness. Most people see quite substantial changes within 3 or 4 sessions, and you'll see even after the first session you'll get a feeling of where this is going and how this can really help you. So if you'd like to get started with me and you like the idea of talking to an online therapist who specializes in mindfulness therapy, then do please contact me. Feel free to ask any questions you have about online therapy or about mindfulness therapy. When you feel ready, we can schedule the first session. The first session is a trial session, and you can see for yourself whether this is the right approach for you. It certainly is for most people. There's no obligations. If it doesn't work for you, there's no cost. If you choose to continue with me during the session and subsequent sessions, then of course you would pay for your sessions in the usual way using PayPal. So please, if you're interested in an effective way of working with anxiety to heal the anxiety without using medications and without spending endless sessions that don't really get to the root cause of your anxiety, then please contact me and let's get started. Thank you.